Hello, good afternoon. This is Dr. Do again. This video is an alphabetic list of problem on letter D. Today I'm going to talk about dizziness, which is so common, and I had another video about dizziness. It's very brief in the foreign language, it's not in English, so I figured I'm going to talk about the dizziness like in a systemic way, talking about what kind of dizziness you can manage at home, or what kind of signs associated with dizziness you need to see the emergency room. So is there any situation associated with dizziness you can manage at home? Of course, you know it. If you're young without any systemic disease, and you know you did not have enough sleep, you know you have been under stress recently, and you know you did not drink enough water. So these are all the causes for a healthy adult can have the dizziness. So if any of these causes you can manage at home, either drink some fluid, catch up sleep, or a relaxation technique to make you feel better, to not feeling dizziness anymore. Dizziness could be very serious, could be indication, could be a sign indicating very serious problem from the brain, nervous system, or the heart, or the systemic disease. So what kind of signs associated with dizziness you need to see the emergency right away. So dizziness is associated with, especially for older people, or if your dizziness is associated with lightheadedness, very you feel like you're stepping on the cotton, you couldn't hold any stability, so that's probably also is a pre-syncope. You're about to black out. So this, and if the dizziness associated with neurological deficit, feel dizzy, and also feel like you feel numbness on your arms, or couldn't move your legs. These are the indication of probably the brain stroke. So, or if the dizziness is associated with systemic problem for the young people, if you know you had a cardiac disease, you had it, but without any treatment, you suddenly feel dizzy, feel heart thrilling irregularly. So that's either for young or older people, dizziness associated with irregular heartbeat. So that's another sign, go to the emergency room. So teasing this emergency situation and conditions that can manage at home. The rest of this class of dizziness, you need to call your physician, even though it's not urgent, even though it's not emergency, but you need to make sure to seek medical attention to address, to diagnose or exclude problems. So what kind of problems can cause those dizziness? Like I said, the brain problem, the blood pressure systemic problem, the metabolic problem, even the ear problem, or the eye problem. So these are all the causes can give you the feeling of dizziness. So regardless of which one, if it is not an emergency situation, you need to see your physician. So usually, like for example, the eyes, they are very straightforward. Especially for children, if you have children at home, without knowing that the children had impaired vision, or just the new glasses probably not properly fit. So these are for the children. They might feel dizziness. They probably not saying it, but when they walk up downstairs, especially walk downstairs, you realize they're like stepping on something uneven. If you notice that, or if the child himself or herself notice that, feel dizziness, then you need to check your eye doctor again to make sure the glass fitting well, or to diagnose whether there's any vision problem. And the ear, because there's the number 8 of cranial nerve, the vestibular nerve branch of the cochlear and the vestibular. The vestibular nerve is associated with the balance. So if a person feel loss of balance, that gives you a feeling of dizziness. So could indicating, especially if it is associated with the tinnitus, hears a buzz in the ear, so that's probably indicating there's something going on from the inner ear, either the fluid or the neuroma grow from that vestibular nerve. And there's another, so these are the very straightforward eye or the ear and the brain. For example, the cerebellum, which is a small structure of the brain located in the back. This cerebellum mainly function is maintain the balance. So if there's something, if ischemic, for example, the vertebral artery going back supply the occipital lobe and the part of the cerebellum. So if they, because of the stenosis of the cervical reticulopathy can cause this vertical artery ischemic, so cause this kind of dizziness feeling because of the cerebellum problem. So if that's the case, may or may not have tremor. Resting tremor may or may not have it, but if that's, especially for the older people with systemic high blood pressure, diabetes, if you feel dizziness, check it out. Even though not in urgency, but you need to make sure, see your physician, do relevant tests to make sure there's no ischemic or there's no hemorrhage inside the brain to cause this kind of dizziness. Or the heart problem, if the dizziness associated with chest pain and thrilling, feel like a little rabbit is jumping there. So that probably indicating, especially if we talk about older people, older and with other comorbidities, other systemic disease like high blood pressure, diabetes, or family history of heart disease, or previous cardiac ischemic. So if you have this kind of other diseases and you feel dizziness, don't take it light. Make sure, take it seriously. Make sure go see your physician, talk to the physician, and do the relative exam. Maybe it's just not serious. Even though you have systemic disease, the dizziness is probably not from your systemic disease, probably just from lack of water or lack of sleep. However, those situations not serious. However, if it is a serious problem, then the earlier the better to see a doctor to get diagnosed, or to get it diagnosed, or to exclude the serious problem. Then you can sleep well, or you can relax. So these are the major causes for dizziness. The other causes probably not quite common in like us walking daily live. You do not have any serious problem, so probably it's not common. But if you have kidney disease, for example, can also have dizziness. Either the toxic directly toxic to the nervous system causes dizziness, or the electrolyte balance can also cause dizziness. And there's some idiopathic intracranial pressure elevation. No causes, just it could be a young person, especially young female, or a little overweight, and walking gait is not steady, and can have just idiopathic intracranial pressure, can give you the feeling of dizziness. So variety of cause of dizziness, some of them, like I said, very serious. You need to manage, go to emergency room right away. And some of them you can just correct the causative factor at home, drinking water, decrease the stress level, and sleep well. So those is another cluster of very easy managed. And the rest of it need to see the medical doctor to seek medical advice to diagnose or to exclude serious problem. So in terms of treatment, those you can manage at home. Those cluster of disease, conditions cause dizziness, you can manage. Like I said, an emergency situation, your physician will treat you. If it's a stroke, will treat your stroke. Manage the time is very critical for a stroke. If a heart problem, the doctor will treat your heart problem. If the iron imbalance or blood pressure problem, of course, the very common causes for older people with hypertension, actually the dizziness is caused by the blood pressure elevation itself. So of course, if that's the case, your physician will let you know. I think educating you, if you have this kind of signs, means your blood pressure is not very well controlled. So you need to see doctor. You see your doctor and manage your blood pressure. So this and if the heart arrhythmia or the neurological problem, then your doctor will treat you accordingly to make sure you feel better, not because dizziness seems minor, even though it's minor from dehydration, can cause loss of balance, can cause the fall, which will lead to a very serious complication, especially for older female, like a female like us from Asian, had high rate of osteoporosis. So if the fall can really be dangerous to older people with osteoporosis, can cause severe bleeding or fracture, so that the consequence is really unimaginable. So by managing those small problems, so can prevent the serious complications. So this is the video of dizziness. I'm going to stop here. And thank you for watching. I hope it helps, and see you next time.